The 2005 peace treaty in South Sudan allowed a return to some sense of normalcy after more than 2 decades of war. In the countryside, farmers were able to return to the land and once again cultivate it, though after a generation away, many lacked the capacity and sometimes the knowledge to farm. And other challenges remained as well. Ongoing instability makes it difficult to move forward and impacts the health of the people who live here, particularly women, newborns, and children. South Sudan has one of the highest rates of maternal and infant mortality in the world. 1 in 10 children die before the age of 5. Women die during childbirth 66 times more often than in Canada. Women and children have high rates of anemia, respiratory and intestinal infections, diarrhea, and malaria. Food insecurity compounds the issue. 1 in 3 households are uncertain of their yearly food supply. 1 in 10 families suffer from severe hunger. Added to this, their food is not diverse enough to ensure a healthy diet. Working with its long-term local partner, Christian Mission Aid, the Canadian Hunger Foundation has tackled the issue in a holistic way. Building on previous projects and its relationships with communities, the Maternal and Child Health Enhancement Program integrated food security with nutritional and clinical activities that have reached more than 15,000 women and 25,000 children. It decreased child mortality, improved maternal health, and cut in half the number of families facing severe hunger each year.
Families are food secure when everyone in the household has access to enough nutritious food to meet their daily needs. Unfortunately, in many of the communities where we work, families typically face a lean season every year where there simply isn't enough food to eat. Food insecure families often face higher rates of diseases and illnesses related to malnutrition, and also children in those families typically have lower cognitive development and stunted growth.
The project provided training in new agricultural techniques, planting diverse and nutritious crops and vegetables. Higher yielding seeds and farming tools were also provided. New boreholes provided clean water and replaced contaminated surface sources.
To improve the food security and nutrition of target communities, we focused on increasing agricultural production and dietary diversity. And within the first 2 years of the projects, households doubled their production of staple crops like sorghum and maize. And also in cases of severely malnourished children and women exhibiting signs of anemia and iron deficiency, we provided supplements to ensure that they stay healthy.
Severe hunger was cut in half. Women's health is showing consistent improvements, and their diets are more diverse because of the introduction of leafy vegetables and an increase in the amount of fish. The number of malnourished children has also been reduced. The current instability may undermine some of the fragile gains made in these remote communities, but the families here have demonstrated incredible resilience in the face of ongoing hardships. With food security and nutrition improving, and improved access to maternal and child health services, there is still room for hope in the future.